Hello, welcome to Dr. Devin's Wellness Wednesday workshop. Today we're going to talk about something called Jim has a sore thumb, and we're going to talk about how you can help prevent athletic injuries, and how you can help to recover from athletic injuries. And you'll learn why Jim has a sore thumb at the end of our talk today. So we're going to spend the next 3 to 4 weeks talking about athletic injuries, talking about problems that you can prevent through athletic injuries, and how to recover from athletic injuries faster. Dr. J.P. Shaw is a medical doctor with the National Institute of Health. The research he did, he found that if you injure an extremity, so your ankle, your knee, your hip, your arm, your hand, your elbow, if you ankle one of those areas of the spine, it's going to cause those same chemicals that help fix that part of the body. It's going to go that, and it's going to put congestion, what he calls congestion, into the spinal segments that are associated with that extremity. So if you injure your ankle, you're going to have a problem in your lower back, the exact same problem as your ankle. If you fix the ankle problem and you don't fix the back, you'll never be healed. This is a medical doctor. This is not a chiropractor. So, you might take his advice better than you take mine sometimes. Like I said, you will never fully heal unless you take care of the spine. The medical standard of care for any injuries is oral medication, NSAIDs, COX-2s, and steroids. It used to be opioids. They still give opioids, but they've created an epidemic where every day over 130 people die in the USA because of opioids. Destroys families. Opioids are just terrible. I had a whole previous episode about opioids and what it's doing to the human species, especially in America. In the 1990s, when the opioid epidemic was just becoming a thing, anesthesiologists were like, hey, we need to earn some more money, so we'll invent something called pain management, because we have really powerful drugs that will take away and make you forget pain. And they did, and it's really screwed up our society since then. Especially with people who work out a lot, there's something called vitamin I. Vitamin I. If you've never heard of vitamin I, it's ibuprofen. Athletic trainers, people in gyms, coaches, they tell people all the time, hey, just pop some ibuprofen before, during, after, whenever you're exercising, just to get rid of the pain. Ibuprofen is terrible. It blocks prostaglandins. Do you know what prostaglandins do? No? Well, I'm glad you asked. Prostaglandins are responsible for capillary dilation. So they make the blood vessel bigger, which brings more nutrients into the area. Causes swelling. You want swelling when you're injured. When the capillaries get bigger and they bring the nutrients in, they also flood the area with, besides nutrients, stem cells. If you know what stem cells are, they're the building blocks of your entire body. So stem cells regenerate everything to make it work better. As you get injured, you can either put down tissue that is brittle and doesn't stretch, or you can put down good, healthy tissue that will stretch, that will move, and that will give you more mobility back to where you were before the injury. And by closing up those capillaries, you will not get the nutrition, you will not get the stem cells, you will not heal properly, and it will eventually cause you to damage your kidneys. So don't damage your kidneys. Next, I'm going to talk about Dr. Baxter Montgomery does this talk to medical doctors about how medicine is, how medical doctors treat people in the United States of America. And his talk is called Jim Has a Sore Thumb. So I'm going to do my best. Dr. Baxter Montgomery, cardiologist from, I believe he's in Alabama. So Jim has a sore thumb. See that? Jim has a sore thumb. Visit 1. Doc, my thumb has been hurting for 2 weeks. Visit 1, evaluation. Jim has had pain in his left thumb for 2 weeks. Vice grip clamped to his thumb 2 weeks ago. I know this is players, we'll just call it a vice grip. Medical and family history are normal. Exam, swollen, red, tender right thumb, or left thumb, right thumb normal, remainder of exam is normal. Treatment, Motrin, 200 milligrams every 8 hours, Tylenol number 3, 30 milligrams of codeine every 4 hours as needed. Follow up in 2 weeks. Visit number 2, evaluation. Pain relief for a week and a half, but increased swelling overall. Remember, Jim has a sore thumb. Increased swelling overall. New onset, constipation. Oh no, what happens when you take a lot of medication? You get constipated. Treatment. Increase Motrin to 400 milligrams every 8 hours. Change to Tylenol number 4 with 60 milligrams of codeine. And give lactulose for constipation. Also, he needs a blood test for kidney and liver function. 2-week follow-up for evaluation. Visit number 3. Evaluation. Partial pain relief for nearly 2 weeks. Continued increased swelling overall. Persistent and slightly worsening constipation. Mild abnormal kidney and liver function on blood tests. Treatment. Add Indocin SR, 75 milligrams twice daily to Motrin. Continue Tylenol number 5 with 60 milligrams of codeine. Lactulose for constipation. Refer to a kidney and GI specialist for abnormal kidney and liver function, respectively. Follow up in 6 weeks. The conclusion of Jin's saga. Sudden onset of fever and chills one night. Remember, this is what the problem was. Admitted to the hospital. Underwent thumb amputation because of gangrenous infection in his thumb. Thumb amputation, kidney failure due to infection and NSAIDs. He was discharged on dialysis after a 3-month hospital stay. But his insurance had no pre-existing condition clause, so it was all covered, so win-win. Jim leaves elated. He excited about his 25 new prescription medications, and he's marveling over the wonders of modern medication and the power of Obamacare. That's Jim's story. So when Dr. Baxter Montgomery is talking to them, he's talking about the insanity of giving medications for high blood pressure and high cholesterol when heart disease is literally a diet problem. You change your diet, you won't have a heart disease problem. The top 3 conditions that we pay for in the United States are all preventable. Number 1, heart disease. Number 2, diabetes. And number 3 is low back pain. All preventable. Basically, all lifestyle. 70% of all the money that we waste in the United States of America on healthcare goes to those 3 conditions. What was the better treatment for Jim? You could have removed the pliers or the vice grip, and then his thumb would have been fine. He wouldn't have had to have it removed. Health and wellness, not just for cardiology, but for your entire spine, your exercise problems. Most of the time they are caused by imbalances in your muscles, some sort of problem, especially in your feet, and they can usually be prevented. It takes common sense conservative care to prevent and heal from any injury. Medication is not the way. So, like I said, over the next 2 or 3 weeks, we're going to talk more and more about how to prevent athletic injuries and how to get back after you have an athletic injury, because most of you out there are an athlete, whether you think you're not or not. So go ahead and like, comment, and share, and we will talk to you soon. Have a great day. Bye.